thank you for joining us on day 14 of the Dr. Joanne Lewis Foundation Heart Disease Awareness Walk. For the month of February, we're walking with you at least for 15 minutes a day, but we ask that you walk for 30 minutes a day and a total of 150 minutes a week. We try to give you little pearls of wisdom every day. We had a wonderful presentation on Tuesday by Dr. Bien-Aimé regarding heart disease. So all month long, we're going to try to raise awareness. And this month, we have a lot of birthdays, but today, the 14th of February, is the birthday of our Haiti Outreach Director, Kevin Lewis. So we wish him happy birthday. We wish you all happy Valentine's Day. So since it's Love Day, I'm going to talk about love and heart disease. Because, you know, love expressed as emotional support, connection, and a sense of belonging has a measurable impact on heart health. The research shows clearly strong social support lowers cardiovascular risk, while loneliness and lack of emotional connection increases it. So what is the impact of love and social support on heart disease? So there's lower risk. Actually, the research shows that there's lower risk of developing heart disease. Large-scale studies show that people with low social support or chronic loneliness have a higher risk of developing cardiovascular disease. Lack of emotional support is linked to higher rates of heart attacks and cardiovascular death, and social isolation increases stress, inflammation, here goes that word again, and unhealthy behaviors, all of which raise heart disease risk. So also love, research regarding love shows that there's better recovery after a heart event. So people who feel loved, supported, or connected recover better after heart attacks or cardiac procedures. Patients with strong emotional and practical support have better recovery, less depression, and better adherence to treatment. Women especially benefit from support from friends, daughters, or sisters, and not just spouses. So there's also, research has also shown that love demonstrates reduced stress and healthier physiology. So chronic stress is a major risk factor for heart disease. Emotional support reduces psychological distress and improves heart-related outcomes. Lack of support increases stress hormones, blood pressure, and inflammation, all harmful to the cardiovascular system. There's also better health behaviors. People who feel loved or supported tend to eat healthier, exercise more, take medications consistently, so they adhere more to their medication regimen, and they also seek medical care sooner. You know, and on the flip side though, loneliness is associated with poorer self-care and higher risk behaviors. That's why we were very proud at the Dr. Joanne Lewis Foundation during COVID that we had Operation Connect, where we provided underserved seniors with tablets to keep them connected. So how lack of love or social support harms the heart? There's increased stress load. Without emotional support, stress accumulates and becomes chronic. Chronic stress is strongly linked to chest pain, hypertension, and heart events. Loneliness and emotional distress increase inflammatory markers, which contribute to plaque buildup in the arteries. Also, patients without support are more likely to be readmitted to the hospital and have worse outcomes after heart events. Oh, anyway, it's a lot. But lack of love or connection often leads to emotional eating, sedentary lifestyle, poor sleep, and less motivation to follow treatment. So how love and connection protect the heart? Emotional support. Having someone who listens, comforts, or encourages you reduces stress and improves heart health. Emotional support is one of the strongest predictors of better cardiovascular outcomes. Help with meals, chores, or transportation reduces physical and emotional strain. The practical support improves recovery and reduces hospital readmissions. Shared activities, laughter, and companionship reduce stress hormones and improve mood. Feeling valued and connected improves mental health, which directly influences cardiovascular health. There are general well-being strategies, this is not medical advice, okay? So because we don't give medical advice here, we refer you to your primary care or cardiologist. But what I can say is build and maintain supportive relationships. So stay connected with friends, family, or community groups. Prioritize time with people who uplift you, not bring you down, uplift. Share your feelings with trusted people, those you trust, okay? Only those you trust. Consider counseling if stress or loneliness is overwhelming. Join clubs, volunteer, or participate in group hobbies. Even small interactions like with your neighbors or your co-workers help reduce isolation. Giving love and support also improves your own health. And so with that, I bid you a happy Valentine's Day. Do something fun. Hang out with those you love. I love you all. I'll see you tomorrow.